I would love to take the time and introduce you to Carrie Ludwig. She's going to be our next presenter for respiratory therapy. Carrie is the Director of Respiratory Therapy Services here at Mary Washington Healthcare. I hope you all enjoyed the previous presentation, and now I want to hand it off to Carrie, and she is going to keep us breathing with respiratory therapy. All right, Carrie, thank you so much for joining us today.
Well, thank you for having me. And thank you for everybody that has joined the call today, taking the time to let me brag about my field of respiratory therapy and brag about the wonderful team of respiratory therapists that work here at Mary Washington. Just want to take a minute to describe what it is to be a respiratory therapist. And Adele, do you guys have the slides? Are you going to be able to share those, or?
Let us take a look here. I'm not certain if the slides I had up and ready, so we'll look for that while you're talking.
Sure. So respiratory therapy during COVID-19, I think prior to COVID-19, no one really knew what a respiratory therapist was or what they did. And then respiratory pandemic entered the world and took us by storm. And all of a sudden, respiratory therapists were at the forefront and really highlighted what a valuable resource a respiratory therapist is. So let me start just really quickly by just defining what a respiratory therapist does. We are experts in pulmonary and cardiovascular systems. So the lungs and the heart, right? So they're very intricately connected. They are very close in the chest to one another, and one supports the other, and the others, they support each other. So it's very important as a respiratory therapist that we are very familiar with the lung and heart anatomy, what the parts are, and who does what. And in that, when patients come in to the hospital and have breathing difficulty, they may have diseases that may cause them difficulty, or they may have a sudden onset of breathing problems. So our job is to work with the physician and the nurses and determine what plan of care that will be best for them to have. So some of those disease processes that patients may come in with would be asthma. They could have smoked for a long period of time and developed something called COPD. So some of you may have family members, if not you yourself, know someone or have asthma, COPD. There's other disease processes that we treat as well. And you may find a respiratory therapist giving a breathing treatment through it looks like kind of like a long tube with smoke coming out of it. That's called a nebulizer. That will help open up the lungs to help someone breathe better that may be having difficulties. We may come and check your blood to see how your oxygen level is in your blood. We may give you different medications via an inhaler. I think everybody's probably familiar with those you see on TV where they hold the tube up, people with asthma, and they squirt it and take a deep breath in. We will administer those. And then we can even help to put a tube down your throat and I see your note, Adele. They were the ones from last year, so we were going to use those. Does that make sense?
Yes, I will.
Okay.
I will look for that.
Awesome, thank you. So the biggest piece is that and this you may have heard on the news through COVID, is ventilators. We manage and run the ventilators for patients. So that means there's a breathing tube that goes down from the mouth into the patient lungs and really supports their breathing, if not breathes for them. And we will connect the patient to a ventilator, which delivers all of the breaths for the patient. So it's very technical. A lot of buttons you have to know. There's a lot of equipment within respiratory therapy that you have to familiarize yourself with. And really, you are basically saving lives every day. We're the ones that when a patient can't breathe, they call us and we run into the room, figure out what the patient needs, and does it for them. So that's really our main job. Places that a respiratory therapist will work. Inside the hospital, you can work anywhere in the hospital. We are in the adult intensive care unit. We're in the neonatal intensive care unit where we care for babies as small as 22-week-old gestation. So they are what we call micro preemies, where they are sometimes maybe just a pound in weight when they're born, and they're in an isolette, and we have the tube down their little throats into their lungs and help support their breathing. We are also in the emergency department. So here at Mary Washington, we have a level 2 trauma center. So there will be a respiratory therapist there. They can attend to everything from all kinds of things, where a patient comes in cardiac arrest, maybe on night shift. You could see a gunshot wound, a stabbing, that kind of thing at night. And it really is just just an amazing field. You can get a little bit of everything. We're everywhere. We can take care of pediatric patients. Thank you, Adele. We can take care of pediatric patients. And that's just inside the hospital. We also can do lung spirometry with patients where they come and there we go. This is a day in the life. This is Dave, one of our respiratory therapists here at Mary Washington. Lots going on in that picture. That's one of our trauma rooms in the ER. And what he's standing in front of is one of our trauma ventilators. So that is, and you can see, talking about all the buttons, that there's a lot on there to manage. So you really have to have the schooling and education needed to kind of care for a very complex patient that's requiring to be placed on a ventilator. And so that is inside of the hospital. And I think some of the slides go into what we can do outside of the hospital as well. We also diagnose lung and breathing disorders. We talk to patients to find out what is their health history, what kinds of medications do they take at home? Is that the best course of treatment for them? And if it's not, then we'll work with the physician to recommend a change based on our conversation and evaluation of the patient. The other thing is we respond to code blue. So in the hospital, if someone develops or stops breathing or has a heart attack, then we will be called to the code blue. And then education, of course, is high on our list. that is inside of the hospital. Adele, you can go to the next slide. Yes. So where RTs work, you can find a respiratory therapist in a hospital. We talked about the newborn and pediatric units. We also will work in skilled nursing facilities, doctors' offices. We have education programs such as asthma and smoking, cessation programs. A respiratory therapist can also work in what's called a sleep lab, where a patient goes to the sleep lab to basically go to sleep, and they're hooked up with a lot of wires and leads that look at their brain waves, look at their heartbeat, their oxygen level, and basically determine whether or not they're breathing appropriately while they're sleeping. A lot of people have something called OSA, where they have to wear a mask while they sleep. You may know family members that may have to wear one of these devices. Basically supports their breathing while they're sleeping. So a respiratory therapist can work in those sleep labs as well. So another thing COVID, the pandemic has taught us is really you need to be flexible. This is one of our respiratory therapists who worked at Mary Washington for 35 years. He just recently retired, but he worked very closely with me to figure out very quickly how to not only protect the staff from contracting COVID from the patients, but also protect the families and visitors and other clinicians from contacting COVID-19. So we really had to figure out how to filter that COVID-19 droplet, that virus, how to filter that before it got out into the air. So really had to dig down deep and research and figure out what the best way to prevent the spread of those water droplets. So that big lesson for us. And then again, we have been a profession since 1950s. So we're a relatively young profession, and often the unsung hero. So we're often kind of in the background. You may hear patients calling us a nurse, or they may call us a doctor, and so again, a lot of people are not aware of respiratory therapists and what we do, but because of the pandemic, we were really thrown into the spotlight here. And again, we just kind of talked about how we protected the patients and the staff from contracting COVID-19, and we used PAPRs and made sure we have appropriate PPE, masking, that kind of thing. Next slide. And again, this is if we don't have the resources and supplies we need. You may have heard on the news, about a shortage of ventilators in New York City, and not enough respiratory therapists. You have to have as many ventilators as you place on patients. You have to have the respiratory therapists to manage them. So these are the scarce resources. So the picture on the left is an iron lung. I think probably you guys may have learned about those in history books, but those really came about during the polio epidemic where basically patients would not be able to breathe. So before they had the ventilators, they had something called the iron lung. And what it did is the patient lived their life in that iron tube. And the tube basically expanded their lung and for them. So it would actually provide the breath for the patients because they couldn't breathe on their own. The picture on the right, the device that you see the waveforms on, that is one of a current ventilator, and you can see the difference there. There is such a need for respiratory therapists. We have grown, you can just see the prediction is from 2019 to 2029. We are the fastest growing profession with a growth rate of 19%. And I did want to highlight here in the Virginia area for Mary Washington, our therapist pay range ranges from starting as a new grad out of school, $31 an hour, and capping at $43.66 an hour. So somewhere in that range is what you can make as a registered respiratory therapist. Next slide, please. And I wanted to sort of describe how to become a respiratory therapist, right? I think we missed that step. But we needed to talk about schools in the area. There are two respiratory schools in the area. There is Northern Virginia Community College has a respiratory program. And we also have a distance learning program. J. Sargent Reynolds has another respiratory program. It's a 2-year program. It is very rigorous. There's lots of studying that needs to happen, but it is so rewarding as a career. I can't tell you. Before I became director, I was a bedside provider for 28 years and loved every minute of it. And you can see some of our therapists here where they, we have put together booths at the hospital, and then just got some of the team during the pandemic, and just a great career field, room for growth, room for movement, and highly recommend it. Any questions? And thank you, Adele. So how do you assess a patient's condition and develop individualized therapies? So here at Mary Washington, we have developed protocols. So we call them patient-driven protocols. And they are based on research, literature, and what is considered the best thing to do for patients and really the world. So we pulled all that information together and made a protocol. So you walk into a patient's room, you talk to them, you find out their history, you listen with a stethoscope to their lungs, you look at their, you check their heart, their pulse, you check their oxygen level, and you look at their chart, you look at lab values, you check their chest x-ray to see if there's anything significant. You look at their white blood cells. You want to make sure they have enough blood in their system. And based on all of that, that's how you develop your plan. And we have guidance here that basically you're scoring a patient. So if a patient has a cough with producing some mucus, then that will produce a particular number score. If their breath sounds, you listen to their lungs and they're wheezing. then that will produce another score, and you compile all of that, and then that helps you determine your care plan. And Adele, I couldn't see, I think she had a second part to her question. I couldn't quite read that.
Let's see. What are some of the most useful therapies for patients with emphysema?
Emphysema. Right, great question. So that that is going to be inhalers, actually. We have steroid inhalers, and we have long-acting bronchodilators. So if you know someone with emphysema, they are probably seeing a pulmonary doctor called a pulmonologist. And they more than likely have described something, maybe a Symbicort. There's also Spiriva, which is a long-acting bronchodilator, and then they may have something called albuterol. They can also take nebulizers, the long tube with the smoke coming out. They may take that at times. Sometimes, they will have maybe some oxygen that can help increase their oxygen level. They may have that at home. So all kinds of different things. If they have a very, productive cough where it sounds like they have some mucus, that there's things that can help them mobilize that mucus and bring that up and out. Very important for them to get that mucus out of their lungs.
Thank you, Carrie.
You're welcome.
Carrie, I have a question for you. It may be on everyone's mind, I don't know. Since COVID, how has that changed the field? We know that we need more respiratory therapists, but did it scare some away? Did some leave? Did it change the education that respiratory therapists receive?
So, and that's also a great question. Yes, some people, so during the pandemic, early when we weren't quite sure how it was spreading, how quickly it spread, really truly just learning things about the virus. And there were some of our respiratory therapists are very young and they have young families, and one of them opted to stay in a hotel for 2 weeks, basically quarantine themselves from their family because they were so worried that they were going to carry it home to their loved one. So yes, people were leaving the field, not just respiratory therapy, they're making decisions to leave nursing, healthcare altogether. It really, I always say that, when you go into healthcare, when you go any field in healthcare, you don't do it for the money. You do it for the love of taking care of people. You hear about the calling, people may have. I don't know if it's necessarily a calling that I had, but I loved making a difference in people's lives. That's what I went into it for. And so people started to make different life decisions. They were afraid. So they did. We had several, the picture of the gentleman that I said retired after, being here 30 some years, he decided to retire earlier than he did. And that was because of COVID. It was a very taxing time. It really took a toll on the team. But I tell you, they were so resilient and so phenomenal during that time. And that's, shows so much and says so much about them,
Right.
As a professional.
Okay, thank you. Pauline in the chat says, what was the biggest change that you had to deal with during COVID as far as treating patients?
So, and, dealing with, and thank you for that question, dealing with, and again, early on, information is just coming at us so quickly, and we had to filter through everything. And then tomorrow we would be told something completely different. And so it really became important for us to get down to understanding the virus, understanding the mode of transition, and feeling, that we were getting all of our information from WHO and CDC, right? So, yes, it was a lot of information coming at us. So we just dug in, we figured out, we know we're dealing with droplet. We know this virus is transmitted from droplet, from person to person. And regardless of the 6-foot rule, I need to be able to protect the patients, the families, and my team from contracting the virus. So we quickly, and again, I'll mention the nebulizer with the smoke coming out. That smoke coming out has potential to carry that virus. So we needed to stop the virus from leaving in the smoke that was exhaling, right? So we needed to filter. So we quickly sourced and researched filters that would filter out the virus. Not every filter filters the same size particle. And so same thing, you may remember the masks, and then the N95 masks, same thing. So we needed to have something that would catch the virus before it went out into the air and the environment. So we had to do that not only with our nebulizers, we needed to do that with our ventilators, right? Because they're breathing, the patient's breathing through the ventilator and it's exhaling into the room. So anybody that goes into that room was subjected to potentially breathing in the virus. So I would say that was the biggest challenge, was determining what supplies we needed to keep that virus contained.
Right. Wow.
And
it definitely sounds challenging.
Yeah.
Definitely. Maxine in the chat asks, do you need another certification if you are an RN and want to divert to respiratory care?
Yes, you would. And you would, and vice versa as well. It is a 2-year program. So if you're an RN, yes, it's a separate program, unfortunately. And I do want to mention also that as a respiratory therapist, you start out with a 2-year degree. There are 4-year programs out there. There are, and you're welcome, Polly. There are 4-year programs, and I'm currently enrolled in a master's program. So, there's lots of opportunity for furthering your education as a respiratory therapist as well.
Awesome. Do you see more schools coming out with new respiratory programs because of the pandemic?
Unfortunately, in this area, we just don't, and it's so unfortunate. I'm actually at this time trying to brainstorm a way that we can partner with University of Mary Washington. I think that would be such a great partnership, and be able to develop a program with them.
I think that's awesome. I can't imagine it's easy.
Right.
Oh, good. Okay. Any other questions in the chat, folks? You feel free. You can certainly speak up, take yourself off mute. Carrie has such amazing information for us in regards to respiratory care. And really, Carrie, you were right. It was unheard of before the pandemic, and then just kind of blew up. And I never realized some of the barriers that you had to face when dealing with that. Hats off to all of you in that field.
Well, thank you. And it just, again, so rewarding, and I love a challenge. So it was right up my alley. I think some days I left pulling my hair out and crying with my team. We all cried together some days, but it's so rewarding.
Carrie, tell us, we'll get a bit personal. Tell us about one of the best times in your career. Give us one of the moments you were most proud of, or that made you the most happiest in your field.
Oh, wow. There's a lot to choose from. I've been in this field 30 years. So there's been a lot. I think, and there's been quite a few, but I talked about the micro preemies. So I talked about the ones where, they're born, for some reason they didn't want to wait the 9 months to come out. They wanted to come out at 4 or 5 months. And, recently we've been able to really care for these babies, and they just grow up to be beautiful human beings. They do so well. And so I would have to say that there was a micro preemie that was born here, and we definitely, so here at Mary Washington, we have a neonatal transport team. So a respiratory therapist with a nurse will get in the ambulance and take a baby in a little tiny isolette and transport it to, either bring it here or take the baby to, Children's National, which we partner with here at Mary Washington. And so we had a micro preemie, and baby was doing great, but needed a surgery. So we don't do surgeries on neonatal patients here. So needed to go to Children's National. So loaded the little beautiful little thing in the isolette, and got in the ambulance and rode the whole way, and just took care. I felt like the baby was my own. Like I felt like I, was, the care was completely, my responsibility, along with the nurse. And so we took the baby had the surgery, came back here, got to the point where it was ready to go home with mom and dad, went home. But I think the best part is that when we get updates from these families, and they'll send pictures of the baby, here she is when she's a year, here she is at 4. And I just think it's amazing because, that we touched that baby's life. We really, took care of that baby when her mom couldn't. And so I think that is probably one of many happy memories, but that's one that comes to mind.
Oh, I love that memory. I can only imagine. Now, for taking care of one of these little preemies and the babies, do respiratory therapists need to have an additional certification, or is that included in all of the training for a respiratory?
Yes. So that's included in your program. You do have NICU training. I do want to say though that it is such a specialized niche that you really have to get more training once you come to the hospital. So when I graduate from a respiratory therapy program, I will not go directly into a neonatal intensive care. I will start, taking care of patients out on maybe the general care floors or the med surg floors. And then as I gain experience, then I will train in the adult ICU. Those are really considered specialty areas. So although you get all of that, you learn the anatomy of a neonate, you learn all disease processes that a neonate may have or develop. But it really, you really need that extra training and orientation once you get out into your hospital.
Thank you. Wow. And What would be probably the biggest piece of advice that you would give students or those looking into the respiratory field? What would be probably the most important piece of advice you could give them?
So definitely look into the program and make sure that it's something that you want to do. Don't go into it for the money, because you have to love what you do. You have to enjoy it every day. You have to get something out of it. So no matter what you go into, it may be IT. Make sure you do it because you truly in your heart enjoy doing that every day. Not just because it has a good price tag. And I would say that that's true for any profession.
Absolutely, absolutely. It is. When you do enjoy your job, it doesn't feel like you're working at all, does it?
Yes.
Right,
Yes.
Absolutely. We have gotten a lot of comments in that say thank you and wow for what you do and how long you've been in the field. I've 30 years in the field. I am sure you have seen changes that happen all the time. And so with all those changes, you still have continuing education that you have to do. Is that correct?
That's correct. Yes.
Okay.
Yes. So we have 30 credits we need to get for our 2-year. We are licensed through the state of, or what state we practice in. So for me, I practice in Virginia, and I apologize, my phone is ringing. But I practice in the state of Virginia, so I I'm licensed through the Board of Physicians through the state of Virginia. So I have a license, and every 2 years we have to renew our license. So to renew, we have to have some education hours, and there's 30 hours that we need to have. And it really, even outside of that requirement, you have to stay on the top of your game because healthcare changes so quickly. You can just see in the pandemic how quickly things changed. So things are constantly changing. The way we practice medicine changes, new procedures come out, new discoveries. So you have to be able to make sure that we're still providing the appropriate care based on those changes. So yeah, there's definitely a lot to keep up with.
Okay. And then in lieu of that education, if you didn't have that, you would have to take a test every year or every 2 years, or it's just that you have to do that. Okay.
Yes, we have to do it. And if not, then we could have our license taken away. And then at that point you would have to reapply and you'd have to test again. And yes, so good to just get that education.
Absolutely. Right. Every field has that part, but it is good. You're right. Healthcare is always changing. And so we're so thankful that you were able to be on this presentation with us today and give everybody a glimpse inside to respiratory therapy. So I am excited. My dad used to be a respiratory therapist, and that was way back in the day. And he stopped, he retired from that. So it is fun to hear about that side of things, you know.
Oh, yes.
So
well, thank you for having me. It was a pleasure. I love, like I said, I love bragging about, the team and everything that we have to offer. And we need respiratory therapists. So please, if you're considering it, apply to a program and let's get you in here and get to see patients.
That's right. That's right. And to all the participants, thank you for joining us today with Carrie. Again, I'm going to put in the chat the evaluation link so you can do that. Remember, just at the end of the day, be sure to complete that. And then also, we are going to take a break from 10 to 10:15, or we just finished up about 5 minutes early. So that was good, Carrie. And let's take a look here for our 10:15 meeting or presentation. We have our financial planning for college. So perfect follow-up. You're thinking about going into a program, maybe for respiratory therapy. Let's talk about finances, right? So we'll get ready for that. I'll put that link in the in the chat here. And don't forget, we want you to go there. That's going to be at 10:15. So we're going to have a little bit of a break. And there we go. You're going to see those 2 links in the chat. So with that, Carrie, thank you so much again for joining
Thank
us.
you.
We hope you have an awesome day. And thank you to
Thank
you
you.
and your team for all that you do. Okay.
Thank you,
And
Adele. Thank you,
to the-
everyone.
Thank you. And to the participants, we'll see you at 10:15 for financial planning. Thank you.